My name's Clare Collins. I'm a Laureate Professor in Nutrition and Dietetics at the University of Newcastle, and my research focuses on programs that help people eat better based on life stage, like pregnancy, or chronic disease risk, like type 2 diabetes and heart disease. And the way I do that is with some really cool nutrition technologies. The reason I am so passionate about nutrition is because nutrition science has taught us so much, and it is complex, but it means that I'm able to communicate that to people using some of the technologies that we've created. So for example, the No Money, No Time website has loads of self-assessment quizzes, information, and even recipes and menu plans that really are translating science into what's to eat for dinner. The type of work that I'm doing is really important for Health and Wellbeing Queensland. They know, like I know, that nutrition science is complex, but people do want to eat more healthily, and knowing where to start can be a challenge. There are some surprising things that people don't know or understand when it comes to nutrition and weight-related health. And the first one is that body weight is only one indicator of health. Sometimes it's an indicator of wellness. So there's a staging tool that asks, for any given body weight, does a person also experience any impairments in their medical health, in their physical abilities to be able to move, or in their mental health and well-being? And if the answer is no, then regardless of body weight, it means carry on. But if there is impairment in any one of those three areas, so what you're able to do, how you feel, and your medical health, then there's an imperative to provide people with access to the resources that they need to improve their nutrition and related health and well-being. That's a really key area. One of the other things that people have no idea about, but this data is available nationally within the Australian Institute of Health and Welfare, and it's called the burden of disease. So they've looked at, well, what are all the factors that contribute to burden of disease? So things like heart disease and type 2 diabetes, all the conditions that mean we don't live as long. And when you drill down into the data from that report, 27% of the burden of the major chronic disease is determined by dietary effects. And it isn't just diet alone. Eating bad food, eating junk food, that contributes, it's believed, to about 5%. But when you look at the effects of diet on high blood glucose, alcohol intake, high blood sugars, and high blood pressure, that adds up to 27% of our burden of disease. And the reality is that we all pay for that because of the cost of providing health care. The other important thing is we actually do have a framework for eating healthily. It's called the Australian Guide to Healthy Eating, and no matter what generation you went to school on, everybody knows that you're supposed to eat a whole lot of vegetables and fruit and whole grains. If we could click our fingers like that overnight and suddenly everybody woke up and just started eating like the Australian Guide to Healthy Eating, then the burden of disease from heart disease would drop by 50%. The burden of disease due to type 2 diabetes would drop by 25%. One of the easiest things that you can do to try and help keep you and your family and everyone who lives at your place more healthy is next time you go to the supermarket, just eyeball all the veggies and fruit. It's the one thing the supermarkets are doing to try and help us be healthy, because you walk straight into that aisle. Eyeball them, find one that has not been in your shopping trolley for a few weeks or a few months, and invite it to get in your trolley. Focus on the produce that's in season so that you're getting bargains, or buy the odd ones. I feel really optimistic about the future and well-being for Queenslanders. I actually think you're really lucky. You seem to have a team who are so committed to improving the health and well-being of the next generation of Queenslanders. I think for this state, things are looking really positive and optimistic.